Well, are you feeling like you need to lighten up? We're talking about your smile, which might lighten your mood once you get that lighter smile. You may be surprised how much it changes really everything in your life. And Dr. Marsh has pictures to prove it. Here he is. We're here at the office of Dr. Stephen Marsh, who helps a lot of people who are unhappy with the color of their teeth. Doctor, it's a common problem, huh?
It is a common problem. Sometimes teeth come in and they're not the color that people want. Sometimes it can be from an injury. The tooth can chip. It can also turn dark, yellow, that sort of thing.
Or over time.
Or over time, just as we mature,
yes.
It can happen as well.
Yeah.
So we help people deal with that with many different approaches.
And the approach has changed quite a bit over time. I know back in the olden days, if you will, wasn't too long ago, where we didn't have a lot of choices.
We didn't. And Joe, this was a standard color sheet that we used to use, if you will. This is a type of porcelain. This was the standard of the day.
So that's the only choice you had?
That's the choice. But as people are whitening their teeth with Zoom and at home, we now have gone to these colors, and most people are favoring these colors. Sometimes you have to match this, and it's whatever the patient wants. But today, more than ever, we're using these whiter or brighter shades.
Well, let's take a look at some of them. Why don't you shine a light on some of the patients that you've had?
And I like that,
and you've
Joe.
helped. Okay,
so
sure.
Our first patient's Leslie. Leslie had an injury when she was a child, and her right front tooth, the viewer's left, it actually turned a little yellow. You alluded to that. It's very difficult to do a single tooth. She brightened up the rest of her teeth at home. With Leslie, we did 2 porcelain veneers in the front. It's very hard to do it as one. We wanted to mimic the other, and that's the result. So it's quite a difference between what she came in with.
It's dramatic. And you know what? It blends.
Oh, thanks. And that's our goal.
That's it.
So Dion, this was a really interesting one. You can see he had also had an injury that sometimes happens. He had a root canal. The tooth had turned very dark.
Oh, wow, okay.
And also the space. And he said, I don't like the proportions of my teeth, and though my family, a lot of them have the space, I'd like to close that up. He was getting married, promised his bride to be that he would get his teeth done. So, Joe, we reshaped the teeth. We did 4 teeth in the front. We lightened that tooth up. We actually put an opaquer over it to block it out, if you will, and gave him a smile that's pretty natural, closed the space in a very symmetrical way. And he was thrilled. He said he's ready to get married now. Lisa, very interesting. I mentioned sometimes people have their teeth, when they develop, come in a different color. And Lisa had been, her mother had actually taken tetracycline when she was pregnant. We know now not to do it.
And that affected the
That affected that's right, the permanent teeth. And they came in, very surprisingly to them, they were very dark. There was not a great way to treat them, Joe, with all the whitening products out there. Still very difficult.
So what'd you do?
So in this case, we did 10 porcelain veneers on the top. Wow. She said she loved it so much, she then came back to do the lower. But what a difference in her. And she said she really hadn't smiled for cameras because of the darkness.
And the veneer goes over the existing tooth.
It goes over the existing tooth. And as I said before, we're sometimes able to block out that color and still make it look natural.
Nice.
And our last patient, Leanne, Leanne's sister had been a patient. Leanne said, as I've gotten older, I don't like the color, I don't like the shape. I've worn them down. I've had a lot of stress raising kids. We all know a little bit about that, or many of us do. So with Leanne, we did 10 upper porcelain veneers, and then we went on to do 10 lower porcelain veneers. So it not only changed the shape, but as you suggested, she really came in for the color, but gave her a smile that she said she feels at least 10 years younger.
Well, you know, whether you just want to change the color by brightening your smile, or you're not happy with the color that's been there for a while, let Dr. Marsh and his team help you do just that. And again, you can give everyone a choice and show them the predictable result.
Yeah, again, no judgment. We want to do what they would like us to accomplish.
All you have to do first is give Dr. Marsh and his team a call at 440-461-1003 or log on to the website clevelandsmiles.com. Doctor, as always, thank you so much.
My pleasure, Joe.